Hi guys, this is Dr. Bhupesh once again, but today I'm not gonna record it and might not put this on YouTube, so I don't have to say who I am. You are my students, so I'm talking only to my students only now. So guys, how to do reading part A. So please focus. So I'm not gonna put that on the YouTube. See how to save time. That is the main question we ask, especially in the part A. And guys, again, you guys, I don't know how come you forget these things when you are preparing for OET because this is so important that reading part A has got 20 questions. Total questions are 42. 20 out of 42 means half, almost half. And A part is more scoring. So A part is almost 60% of your marks because it is more scoring. In part B and C, you might get 14, you might get 15. In part A, you can get 18. So definitely part A should be stronger. And when we talk about time management, if we can understand part A, part B and C time management would remain the same. The main thing is do not do difficult questions in the first round. That is applicable in the A part as well as B and C part. Means do only easy questions which are easy to be found. So let's see. Rationale for inguinal hernia. Rationale means reasons. This is a hard word. It will not come, but generally, rationale means reasons. Reasons for the inguinal hernia. What happens during surgery? Surgery means treatment part. Care before and after surgery. That means before treatment and after treatment. During surgery, before and after. Potential complications post-operatively means after surgery. Forms of inguinal hernia means classification, category. Recovering from inguinal hernia repair means again that post-operative recovery. Now I don't have to do anything. I have to do 1 to 7 questions. This reading has got 6, but in the final exam you will get 7 questions. So let's see how much time does it take. Inguinal hernia topic: bladder worsening, coughing, protrusion, markedly bigger, depend upon the type of inguinal hernia. Cause can range from mere birth, weakness. So causes are given here. Inguinal hernia, general things are given over here. Okay. Oh, I don't know what happens to this. Okay, second. Indirect and direct inguinal hernia means classification. Maybe this is the topic. Forms of inguinal hernia. Direct inguinal. So my one answer is ready. That is how simple it is. Don't go deeper. Just try to find one answer at a time. Uh, Inguinal canal, reduction, bulge appears, direct inguinal hernia, old age, defect not controlled. Okay, topic done. How are the inguinal hernias treated? Open hernia repair, sedation, general anesthesia means they are talking about surgery. Surgery. Laparoscopic, people who endoscopic like generally experience a short recovery time. This, however, the healthcare provider should assess. That means post-operative care. Again, surgery during what happens during surgery. So this answer should be what happens during surgery should be in the B part, C part. Sorry, C part we have done. And rationale for the inguinal hernia means reasons for the inguinal hernia. It should be in the causes, should be A. Little difficult reading, not very easy. Potential complications, nursing interventions, place the patient in this. Skin irritation, this closely monitor. Control fever, inguinal hernia may be even post-operative interventions. So post-operative interventions, post-operative care, encourage, administer analgesic. Little difficult means not the exact word are given. So obviously it doesn't seem like an easy listening, easy reading. But recovering word should be here only. So I think this should be D. I'm just putting flukes. It's a difficult one. Still, let's see how many speculations or guess would be right. No wastage of time. It will take 2 minutes in the exam. I'm teaching you, that's why it's taking time. Recovering, most probably D. Forms, 100% B. Potential complications, if it is given over here, potential complications. People underestimate generally experience short recovery, surgery to have, and complications. Complications word is given over here. I was trying to find here, but over here I think complications were not given. I wanted to do D, but we'll do C. Care before and after the surgery, place the patient, post-operative care, do not allow the patient to cough. I think after surgery, to given is over here, D only. What happens during surgery should be in B part, and rationale means A part. So now please help me what questions I have done right and what I have done wrong. There can be two wrong and that will happen. That is what I am saying. If you tell me, sir, which questions you would like to leave, I will say third and fourth, I am not sure at all. Second also, I am little confused. So now you can tell me the answers, please. Rationale, reasons A only.
Yes, sir.
All good, all good reasons. Then second is what happens during surgery. So during surgery should be in B or in the C, sorry, C. Where it is?
C.
Second answer.
C.
C, sir.
Care before and after surgery. D.
D is
Yes,
correct.
sir.
Fourth, post-operative complications. Complication was given in the C.
Correct,
Yes,
sir.
sir. Yes, sir.
Forms of inguinal hernia, 100% B, no doubt. I don't have
Yes.
doubt. Recovering may be in D, most probably.
Right, sir.
So again, this much time it takes if you have basic understanding and if you have confidence. And you should know one question can be wrong even in the final exam. But try to get them right. So what I do, second, so what I will do in the final exam, I will attempt 3 or 4 questions. This complication word I could find, this and this. Now rest of the things I will put a dot in the final exam. That I will, Ashu ma'am, you can take your yawning by keeping it mute, please. So you can do these 3 questions later on. That's the only thing. Don't have to waste time. So this, you don't have to waste time. After surgery, you will find here, obviously, nursing interventions and recovering was also given. So these 2 questions to anyhow, would be in the same. So now, even after giving time, you cannot be sure about second, third, and sixth question. So please do not waste your time. Automatically, you will save your time. Now, let's see the time saving mode, and you will all help me. I know. Question number 9. Which is the site incision for open hernia repair? Which it would be given open hernia repair was given in
C.
was given in C.
C.
There was the word we read. So healthcare provider usually gives a local anesthesia sedation, and they are asking about that incision. Incision word is given where?
Sir, cut is given.
Cut, where is it? A cut is given in the groin. Okay. So which site? Groin is my answer. Means now I am saving my time because I know it is not in A, it is not in B, it is not in D. That is saving of time. What medication is used to control fever? Fever would be in the complications. So it should either be here, but we remember the complications were given over here. So what was the medication that was given in the fever? This was the fever. And where any medication?
Sir, the answer is in D.
D.
E
D.
isn't.
D in the
Yes,
nursing
sir, D. D, sir.
uh,
Sir, in 7 points.
this one.
Acetaminophen. The
Yes.
control fever with acetaminophen.
Control fever.
Okay, sorry. And now I know this question is taking time, and I was expecting it to be in C. See the wastage of time I have done right now. Because you have done this reading, but actually look at the scenario of the exam. I was expecting it to be in C, where complications were given. Then nursing interventions, I should have understood the word interventions are given over here. That means treatment should be here. So I should have tried here. But if I am not finding it, this is the wastage of time. So if what I can do in the final exam, that is, then you will be able to manage everything. That's it. Move on. Now you are saving time. Sorry, eighth, saving time. And now we will not all the questions would be difficult. Which group direct inguinal hernia was given in B forms of inguinal hernia? So you go and you just find the group. Controlled
Sir, direct.
children and young adults.
Sir,
Children,
direct. That is indirect, sir.
that is indirect. Oh, sorry, direct. Old age. Old age is the answer. Which group?
Yes, sir.
Yes, sir.
Noted. Means it is very difficult when I am doing it over the laptop because I have to change the screen. In exam, it's easier. So just consider now easy questions. These are easy questions. Yeah, you know where they are. Which device is used to view the internal body in laparoscopic surgery? Laparoscopic surgery this, but laparoscopy was given in C. And now I should remember the question which device is used. वैसे तो laparoscopic just over here. A surgeon performs hernia under general anesthesia laparoscope. That's it. That's the answer. That's the device laparoscope.
Yes,
Yes.
sir.
Yes.
Nothing difficult at all. No wastage of time. Which is the type of hernia surgery where a mesh patch is sewn over the weakened region? Again, it would be either in B or in C. C has more chances because open repair surgery. So repair surgery mesh patch. So I have to look mesh patch word in this. That's the only word I'm finding. Mesh patch. Mesh patch. Mesh patch. Mesh patch. Mesh patch. So now I have found the place. Now I will read the question again. What is the type of hernia repair surgery? No, that's too simple. Type open hernia repair. That's the only surgery they are talking about.
Yes, sir.
That's the only thing they are talking about. Done. Sorted. Next question. Which surgery needs less recovery time? So forms of surgery, if it is given over here, if it is given less time, less time. Now this is the question I am confused because I don't know. Like he's asking from here, open, direct or indirect, whether it is given. But I try if I can see the time. No, then I give it a try. Time. Nah, time is not given, so I'm unable. This is again wastage of time. Now this is the question I will leave in the first. Which surgery needs less, or maybe the recovery time can be given over here. But again, see, that is wastage of time because I don't know where it is. B, C, or D, it can be anywhere. So I will put a mark and I will go on. This is saving of time. Even in the part B and C also. That is the exact thing you need to follow. If you're not finding something, please let it go for that moment, put a mark, and then find it later. That's the only thing you have to do to manage time. You have to be confident. It's like when you play any game, whether it is a basketball, there are certain positions when you get the ball, basketball, and you are not placed right that you can throw the ball on the net. Then don't throw it now. Pass it on. Pass it on to other who will have the mind. So leave it for the time being. That's the best thing. Pass it on to subconscious mind and involve your conscious. What is more prone to develop? Who is more prone to develop inguinal hernias? It should be in A part, I think. Who is more prone? Who is more prone?
Old age.
Old age. That's then so it should be in the B. But again, it's a difficult question.
No, sir. Man, sir, is A.
That's the answer. That's the fine. It is common among men. That is what I'm trying and
Yes,
say.
sir.
But this question was little raw, if you understand, because this answer could have been old age as well by chance. This question should be more precise. Which gender is more prone? Then 100% men. Who is more prone? Sometimes you will say this. But again, in this comparison was not given that men are more prone or adult. Although indirect inguinal hernia is more prone in this, but again, the answer should have been men. That should be in part A. Okay, which position is recommended to relieve crushing on the point of hernia? So it should either be in C, maximum chances in D, nursing intervention. So position, Traders break position. Easy answer. These questions are easy. You know where they are. So you have to improve your skills, and that is what you need to understand. So when you will do this reading part A again, you will say, "Sir, I remember all the answers." Buddy, you will not get this reading in the exam. Please try to know how could have you found the answers easily. That is the question you should ask. So when you do reading part A for the second time, you try to follow this method. The food that is rich in dash aids in hindering symptoms, alleviating symptoms. I words and it should be given in this. Food should be given nursing interventions. So if food is given, eating high fiber food, right? That's the answer. High fiber food,
Fiber, sir.
but it should be high fiber foods. It should not be
Sir, the question asks about the food that is rich in.
in fiber. Yeah. Now that makes sense. See, that also answers your question as well, Karuna ma'am, that S should be there or not. Now this is the place. The food rich in high fiber. High food is also fine, Kajal ma'am. But we should not say a rich means high. Yeah, that's the food that is rich in fiber. Makes sense. Now this is the trickiest blank. In terms of blank, this is the trickiest one because rich means high. So they have already given a synonym for the rich, for the high. So you just have to put the fiber word. That is trick now. That is where you should be excellent to improve your marks. In order to numb the lower part of the drug is injected to this. So where would it be given during the surgery wala part was given in which part?
C.
C. So
C
C,
part.
let's see numb word where it's given. They would be numbing it in the start only, I guess. Numb as soon as the spinal broke around the nerves in the spine. And now out of this, I have to find the right word. So now I will read the question again. So it's not taking time in order to read it's over the spine, over the, around the, over the article. See, articles are very important. Over the nerves. These are the things, articles, these over around bit of synonym changes. If you will consider, you will suddenly see lot of improvement in your marks. If you can get 18 marks in the part A, then obviously you will pass. Obviously. Deformity in the indirect inguinal area is not as it is in the back fibers of the external oblique. This is a tough question. It should either be in the indirect wala part. So I will try to find the word deformity and back of the fibers. Deformity backward. Deformity, yeah, deformity means defect. Not palpable, it is behind the fibers of the external. So I have found the location, it is definitely in B. So I will do this question. I will try to do because I have found the location easily. Is not dash, the deformity is not palpable. Easy. That is what decides whether I should do this question or not. The dash associated with the is not typically associated by the common. Where should it be given? The dash associated is typically exhibited. This is difficult, right? This is difficult. I will leave it. I don't know where it is. Open surgery usually requires last incision instead. Where should it be given? Open surgery, where should it be given?
In
Sir.
C.
In C.
Part
Part
C.
Part C. Indirect inguinal hernia, where should it be given?
Sir, part B.
That's the way. So 18th, I am not sure because I don't know what it is talking on. The dash associated is typically exacerbated by common activities. It should be in D because they are saying how does it get activated, or it can be in the complication part. So I have to find the word activities, or it can be in the A part. Cause can also have the activities because they are activities. There it is. Now I have found the word. Now I will first I see where it is to save time. Then I do the dash associated is typically exacerbated. The dash associated, something is associated with it. Something is associated. The cause of the cause can be mere birth, weakness within the abdominal wall, stress from the bowel or urination. It is such an extensive gain create a hernia. Now this is difficult. Nothing is associated. Weakness. What is the answer given?
Symptoms, sir.
This is difficult, yeah. This is difficult. You don't know how to write. Associated word should be given somewhere. This is difficult. Or it should be given somewhere else. Activities, activity.
So it's in first paragraph,
Okay.
pain related to, but I got pain, but it was symptom. Second line, the pain related to inguinal hernia worsened when coughing, exercising, and
Here it
doing.
is. Here it is the pain related to inguinal hernia worsen when the cupping. But again, it's really hard. Again, this is the blank we would miss in the exam. And I believe such kind of blank should not come and nobody will write symptoms. So we should not worry about these kind of blanks. Now I should be worried about my rest of 19 questions. So I have done all the things. I have found almost every question. Eighth question or 12th question I left. Which surgery needs less time? So now I will get time to find that thing. Which surgery needs less time? So it should be given in the C. Which surgery needs less time? Now I want to find the time because that's the only question left I have to do. Now I'm not finding it. Up now understand
Last paragraph.
The part C last line.
part
Last
C
paragraph.
or D.
Last
C,
para.
sir.
Part C. Para.
Sorry.
Time is
Part
given there.
C, sir. Last
The last
paragraph.
paragraph.
That is where I checked out, but I could not find it. I was also trying to find in C.
Sir, last
Sir,
paragraph.
This
it
one.
says people who
The
undergo
What the
laparoscopic
last
recovery?
hernia
line.
repair
Time is
generally
there mentioned.
experience.
Lapros-
Recovery time.
laparoscopic hernia repair.
हाँ जी सर.
Okay, very nice of you. Thank you very much. Now see, please try and understand. If I would have wasted time on this question by chance in the final exam, what would have happened with my these questions? That's the only trick of reading. Be very strong to leave the question. If you're not finding it, please leave it. You have the time to rethink later. But if in that quest you miss out on these easy questions, suppose the last two questions are left by chance because of time, then even last two, then you will regret why did I do this question, which was hard to find. Shorter recovery period was not an easy thing to find. So then you will regret about it. If you find it, see, it also depends. Some questions I will find, some you will find. But if you are not finding, if it is your exam, leave that question which you are not finding. That's the only point. And the same fundamental applies to part B and C. If you have time, and sorry, if you are finding the answer and you are close to answer, reinvest your time. If you are not understanding the question, if you are not understanding the paragraph, why are you reading it again and wasting time? You can do it later. Then time management will not be a problem. Any person who does only easy questions first will always be happy because he has secured easy marks and now he is trying to do difficult questions to get more marks. So he will or she will always be safe. That's the way to save your time in OET reading and to become the best, even the best what you cannot imagine of yourself. You will become that best. Because when you will invest the time in the right questions, you will see your productivity increasing. And that is what it is all about. Thank you very much. This is Dr. Bhupesh. Exclusively for you, we will not post it on the YouTube. From now onwards, I am changing few bit of strategies. Thank you.